Hey guys, today I would like to share with you everything you need to know about IV therapy. What is IV therapy, benefits, side effects, and costs? Well, this article is listed on Forbes.com and for claims of boosting the immune system and alleviating hangover to support weight loss and reducing the sign of aging, the purported benefits of intravenous IV therapy are numerous as the vitamin and mineral cocktails available. Why anecdotal evidence support the potential benefits of IV hydrations and vitamin therapy, scientific research is lacking. So we're on to learn about both elective IV therapies and those used in hospital settings, as well as potential benefits, side effects, risks, and associated costs. So tired.
No sleep last night? Not good?
3 a.m.
Oh my god. Working?
Study.
Studying.
Training.
Wow.
Yeah, I woke up 9:30.
Too early.
Too early?
Okay, now put your makeup wrist. I want you to make a wrist and fracture. Okay, now 통통. 통.
That hurts.
That hurts. Needle. Pain for beauty.
Oh, God.
All needles. 통통통.
I don't even want to look at it. Oh, it's poking. Do I still do a fish pump?
Oh, it's okay. To open up.
How long will it take for this?
Oh, like another 30,
Okay.
20 to 30, or if you want a little bit slower, maybe 40 minutes.
Okay.
It's fine. Is it fine for you?
That's fine. So the IV go to the body?
So your body's gonna get some energy.
Do you feel anything right away or have to be a couple hours to experience?
Couple of hours. Or some people right after. Oh, it depends.
Yeah, it's my first time.
Ah. You want me to make a little bit head up?
Oh,
Or
this is
position,
fine.
okay?
Yeah. Thank you.
You're welcome. You can be okay to make a little bit move
Okay.
slightly
Okay.
because it has a flexible needle inside. So you don't need to do this way for 30 minutes.
Okay. Okay, thank you. First, what is IV therapy? So IV therapy is a method of administering fruits, medications, or vitamin directly into a patient's bloodstream intravenously to address a variety of medical conditions, including nutritional deficits. The goal of IV treatment in a hospital setting is to replenish substances that the body has become deficient due to underlying medical condition, explained Eileen O'Sullivan, MD, an emergency medicine specialist in Portland, Oregon. Certain medications require IV administrations if they are needed very quickly and cannot be administered or absorbed by the body via another route, she adds. For example, if an individual can take their medications orally due to vomiting, or if they need an urgent dose of antibiotics due to a severe infections or sepsis, they would need an IV therapy. Medically necessary IV treatments are traditionally administered in hospital or infusion centers, which are outpatients. Non-hospital facilities are qualified for provider-administered medications infusions. In recent years, however, independent boutique and community providers offering elective IV hydrations and vitamin therapies are become increasingly popular. Despite this rising popularity, there is insufficient scientific evidence to substantiate the purported benefits of non-medical IV therapy, say Dr. O'Sullivan. However, the risks are clearly understood, she adds. When it comes to IV therapy administered for non-traditional purposes outside of a hospital setting, marketing typically focuses on wellness, which can be a vague term, notes Dr. O'Sullivan. These loose categorizations may also account for the scarcity of high-quality research. Wellness is difficult to test and measure and is to some extent subjective. If a person fatigues, there is no diagnosis diagnosis or treatment in the hospital that say, "You are fatigued, here's an IV bag," say Mondrena Williams, a doctor of nursing practical and owner of Vital Mineral IV Therapy Drip Center in New York City. Dr. Williams said she works with many patients who experience fatigue or brain fog or feel generally run down. They tell me how they feeling. I ask them if they have blood work, and if they don't, I do a full history and physical, and then I decide based on what they are experiencing what are vitamins to recommend via IV therapy. So what is IV hydration therapy? IV hydration therapy is replenish blood fluids when an individual requires rapid rehydrations and or is unable to hydrate adequately by drinking liquids or through intestinal absorptions due to medical conditions. IV fluids is a water-based solutions with added electrolytes, explained Dr. O'Sullivan. The exact compositions of IV fluids is designed to mimic the physiologic fluid that exists in our body, she adds. Centers often refer to hydration bars or drip bars, offer IV hydration therapy outside of hospital or intensive care units. These facilities are open to any consumer and don't require individuals to have prescriptions. Through consulting with your healthcare provider before receiving treatment is always a good idea due to potential risk factor for certain conditions or drug interactions. Potential benefits of IV hydration therapy. IV hydration therapy is an effective treatment for severe dehydrations, which can be caused by fever, excessive sweating, or urinations, vomiting, diarrhea. People with chronic illnesses such as diabetes or certain kidney conditions may be at greater risk for dehydrations. Rehydrations restore the correct electrolyte levels in the body. One of the most common IV treatments is a simple saline solutions containing water and sodium chloride, but solutions containing sugar, glucose, dextrose, and lurose are also frequently used. Dr. O'Sullivan emphasized that the goal of IV fluid administrations is to achieve an optimal fluid level in the body by replenishing liquid the body has lost due to any underlying medical condition. The fluid level is regulated by complex body system and is difficult to mimic, even by health professionals, which is why she said she's believed oral hydration is always ideal when possible. One exception to this rule of thumb may apply to athletes who exercise in hot and humid conditions. If their training sections or competitions occur back to back with little recovery time between and they need to rehydrate quickly, using both oral and IV fluids combined with oral glycerol, also known as glycerin, which is sugar alcohol that attract moisturize and support fluid retentions, may restore body fluids level more quickly than oral hydrations alone, according to a small 2015 study in Scandinavian Journal of Medicine, Science and Sport. However, for someone with an adequate hydration status, the benefit of IV hydration is extremely limited, cautious Dr. O'Sullivan. What is IV vitamin therapy? IV vitamin therapy introduces vitamin into the body intravenously to address the deficiency of physical conditions. Disorder may necessary an IV vitamin treatment include pernicious anemia, diarrhea, and malabsorption, issues caused by damage of the intestines. An IV treatment is also often utilized after surgery, following acute kidney injury, and or when a patient has suffered major burns. The doses in an IV treatment contains a higher concentrations that might be found in oral vitamin supplements. Blood vitamins introduced into the body through the IV may be absorbed more efficiently than those ingested orally. The aim is to achieve balance. The body is designed to function with vitamin levels within a specific range. Medical conditions can result when there is cease or deficiency. Similar to IV hydration therapy, the goal of IV vitamin therapy in medical setting is to correct these imbalances to prevent problems that could result should be deficiency go unaddressed. Potential benefits of IV vitamin therapy: if you perform a web search for a nearby IV vitamin therapy provider, you are likely to come across offerings like immunity drip, beauty booster, jet lag bag, cocktails of vitamin or mineral formulated to address a vast array of concern, including fatigue, brain fog, and chronic pain. However, if an IV vitamin supercharge may intuitively seem beneficial, there is little scientific evidence to support the proposed benefits of high-dose IV vitamin infusions. While the notions of high vitamin and hydration level may sound appealing, the boring truth is that the body has tightly regulated mechanisms that keep out fluid status and vitamin level in specific range, explained by Dr. O'Sullivan. IV vitamin therapy is an effective and efficient way to correct deficiencies and counteract the negative effects of certain medical conditions that cause vitamin imbalance. However, there is insufficient research and evidence to support claims that vitamin therapy provides great benefit to someone with normal vitamins level. She reiterates. Certain vitamin deficiencies are prevalent among certain populations in the U.S., but these rates can vary significantly based on demographics. For instance, while about 25% of the U.S. populations may have inadequate vitamin D levels, these insufficiencies are much more common among individuals with darker skin as well as older adults, according to the National Institute of Health Office of Dietary Supplements. When Dr. Williams opened her IV drip center during the height of COVID-19 pandemic, she encountered many patients who were surprised to learn about their own vitamin deficiencies. I started the center during COVID because I realized so many people got sick because they thought they were healthy. For instance, vitamin D plays an important role in regulating appropriate immune responses in your body, and a deficiency can make an individual more vulnerable to infections. In fact, a recent review in Antioxidants concludes the deficiency in vitamin D3 may increase COVID-19 infection risk as well as severity of the illness. While research indicates that vitamin D deficiencies can be adequately addressed with appropriate oral supplementations, Dr. Williams promotes IV vitamin infusions because of its immediately bioavailability. It goes into your vein. You are not losing anything in your gut, she explained. IV therapy is a common practice in hospital setting and independent clinics, but complications can occur, including infections at the insertion sites and fluid creep or volume overload, in which excess fluid in the bloodstream can spill out of the lungs or other tissues, causing dangerous complications such as pulmonary edema or even cardiac failure. In the case of IV vitamin therapy, once adequate vitamin levels are reached, the body typically removes excess vitamins via urinations, explained Dr. Sylvian. However, excess of certain vitamins such as fat soluble vitamin A, D, E, and K can result in harmful toxicity to internal organs, she warns. To mitigate these risks, It's important that a trained medical professional oversee the administrations of IV therapies. However, not all clinics have the same level of oversight because regulation guidelines for infusion therapies vary state by state. In recent years, marketing claims by some IV therapy bars make unsupported claims that their IV vitamin infusions could treat serious diseases. In 2018, the Federal Trade Commission's FTC charged one seller with market deceptive promises about their IV cocktail's ability to treat cancer, congestive heart failure, and multiple sclerosis. More recently, the FTC sent warning letter to another IV therapy center for making unsubstantiated claims regarding its product's ability to treat COVID-19 effectively. So the cost of IV therapy. Elective IV therapy is generally not covered by health insurance, and each infusion can sport a hefty price tag. The price of IV therapy varies nationwide, but customers can expect to pay on average between $200 and $400 per bag, depending on chosen hydrations or vitamin mixture. Where to receive an IV therapy? Outside of a hospital setting, one can find elective IV hydrations and vitamin therapy in many different locations, including integrative and alternative health clinics, gyms, and med spa. Dr. Williams suggests considering the following criteria when selecting an IV therapy location. Choose an experienced provider, preferably someone at least one a couple years of practical experience. IV therapy must be administered by a registered nurse, a licensed practical nurse under the guidance of registered nurse or a nurse practitioner. Ensure the location is clean. Ask about where the clinic resources the vitamin or other supplements. For instance, Dr. Williams ensures her medication come from the US-based pharmacist. The National Infusion Center Associations offer this tool for providing non-hospital infusion center in your area. Prior to the beginning of the IV therapy, consult with your health care provider about whether you need to consider any precautions or contraindications due to your unique health history. So I actually came to the med spa in Los Angeles for a while now, and usually they give me BOGO, but since I bought a few times, so they can able to upgrade to 15 sections for a certain amount of price. So if you tell them my name, Tanva from YouTube, you will able to get 20% off for any services here at the med spa. So we'll make sure to attach the address and then information below on the descriptions, and you can contact them and get the best deals on the market in Los Angeles if you are considering getting the IV therapy here. So, who should consider IV therapy? Individuals with nutritional deficiencies, malabsorption issues, gastrointestinal disorder, or chronic condition like kidney disease, or who recently underwent surgery may be in need of additional nutrition supplementations and could be good candidates for IV therapies. Though some of these conditions would require IV therapy administrations in a hospital or clinical setting. When vitamin supplements are tolerated well by most people, some vitamins and vitamin blends are unsafe for people with certain medical conditions. For people interested in elective IV therapy, the U.S. Department of Agriculture offers a free tool that can help one calculate their unique daily nutrition recommendations. Both Dr. O'Sullivan and Dr. Williams emphasize how important it is to review any specific concern and option with a healthcare provider prior to receiving any IV therapy. What is that on the tape? This one.
Oh, it's just an emergency kit.
Oh my gosh.
But it doesn't show my lips.
Just only me. You have so many pimples, I don't know why. Hey guys, so I am in front of DELUXE Med Spa. Like I said, this way has been a place that I've been coming here every single time now because it's so close to where I live, around like 15 to 20 minutes. Without traffic is 15 minutes. I actually just finished the the IV hydration therapy. This is also my first time doing it. It's just a little poke and hurt at the beginning when, put in the needle. But the whole time it was super relaxed, and at the same time it's like I feel something running in my body. And I also just did a Botox. I frown right now and then raise it up. Since I just did it, it's not gonna affect and then see anything right away. So it will take a couple hours. I won't able to lay down for 4 hours, and it will take effective see the result around a week or 2 weeks, depends on the body. And I got compliments from my lip because I actually did it like a year ago, but it's still showing right now. It's still good, which is great. Usually it's only takes like 6 months and faded already, but I still have everything here on my lips. And then I did, it's like a mastery, make the face smaller before, so I'm planning to come back and do that because it make my face looks more like youthful and just look younger too in general, because when we eat a lot of things like go to the face and make the face bigger, but this wasn't the case. I feel more confidence and my face looks so like glowy. It's just natural in general. It just make the muscle on the side of right here, the chin, and also the face smaller. And yeah, I think I'm gonna share more, but right now because of the liquid or the IV hydrations, I feel a bit good, more energy a little bit, and hopefully it will see a lot of difference 4 to 5 hours later, because it will take a couple hours for the IV hydrations to actually kick in. So I'll keep you guys updated, but now I'm going to the next appointment for checkup. Like I said, health is one of my biggest issues for this year, so I did the liquid IV and also Blvd because you want to walk into a new year look more youthful, healthy, and strong. So that's me in general to share my experience. So like I said, if you would like to come here at DELUXE Med Spa in Los Angeles to try it out, mention my name, Tanva, from YouTube, and they give you 30% discount for any services you would like to try. And also I will give it's like Botox as a complimentary for sharing experience, and hopefully you guys can actually help me with that, and also it's beneficial for you. So here to try the best experience that I got, and I would like you to be a part of that. Alright, so I'm gonna go right now and see you guys later.